Hey guys, we're out here today at Austin Retina Associates, and I'm with Dr. Ryan Young. He's a board-certified ophthalmologist and fellowship-trained retina surgeon. Doctor, good morning.
Good morning.
Thank you so much for being with us. This is tough for me to even say, but I know you're seeing a lot of it, so we want to talk about it. It's exercise band eye injuries, and we've seen a big spike in them over the last year. What's happening?
Well, I think part of that has to do with the pandemic, right? People are more exercise conscious nowadays than they ever have been, which I think is great. Unfortunately, with the pandemic, people haven't been able to do the usual outdoor exercise or going to gyms like they used to, so people are taking it indoors. One thing that people are doing indoors is making good use of exercise bands, which overall is good for your health, but unfortunately does lead to some eye injuries.
It hurts to even think about, but I know even some famous people have had issues with this. For example, Savannah Guthrie. So let's talk about what kind of injuries we can end up seeing from messing around with kind of that at-home equipment.
So the eye injuries are extensive. They can be as simple as a corneal abrasion or some bleeding inside of the eye or inflammation inside of the eye. More serious eye injuries can be things like torn pupils, torn irises, cataracts, bleeding inside of the back of the eye, and then unfortunately in extreme cases retinal tears and retinal detachments.
That is a pretty big host of problems. And cataracts, I would have never known. So this is why we have to check in with an expert. Let's talk specifically, though, about the last one you mentioned, a retinal tear or detachment. What are those? Are they the same thing?
So the retina is basically the film in the back of the eye that turns light into an image that the brain interprets as what you're seeing. The retina is a very thin, translucent membrane in the back of the eye that can be easily torn from things like trauma, like from an exercise band. A torn retina is when the retina is traumatically torn and you develop a hole in the retina. That hole, in its early stages, can be treated quite easily. In more advanced stages, when fluid is able to get underneath the retina through that hole or tear, is when you can develop a detachment of the retina. That's when the retina actually comes off the back wall of the eye. I equate it to the wallpaper coming off the wall in your home.
Okay, and that sounds really serious. So even as you're talking, I'm hearing that time is of the essence, and you probably want to be checking with a doctor sooner rather than later. So let's talk about some of the symptoms you might see with a retinal tear or a retinal detachment.
So the biggest thing with a torn retina would be floaters. Bleeding inside of the eye often presents as numerous floaters inside of the vision. People describe them as little black dots or specks or flies flying around inside of their vision sometimes. That's when the retina is torn, it releases blood and pigment and debris inside of the back of the eye. If you have those symptoms, especially after an injury, that's really important to get that checked out within 24 hours at the latest. A sign of a detached retina, when the retina actually comes off the wall of the eye, would be loss of vision that can start in your periphery. As it progresses to involve the central vision and ultimately can result in blindness if left untreated.
Okay, really scary, and of course we want to keep our eyes healthy. So let's talk about this, because this is all you do. This is your focus. You know, you're the expert in this. How you diagnose and treat a retinal tear or retinal detachment. A couple parts there.
So the diagnosis is done based off examination. If a patient comes in with symptoms concerning for a retinal tear or detachment, we'll see you here in the office, dilate the pupils and examine the retina. We have several imaging techniques here that we can do as well that help us visualize the retina. Things like ultrasounds and various imaging software for the back of the eye that allows us to visualize the retina, as well as regular examination techniques where we dilate the pupil and look inside. In early stages with a torn retina, we can treat that here in the office with either laser or cryotherapy to either freeze the hole or create small burns with laser that can seal the holes or seal the tears. In more advanced stages, when the retina is actually detached from the back wall of the eye, is when it becomes a surgical approach, where we do surgery to actually go inside of the eye and physically reattach the retina by using gas bubbles and things to push the retina back in place.
That is some pretty fantastic science as you're just listing it off. But I know it's really important for people to come and see you, and every person is unique, right, who comes through this door.
Definitely.
So they can go ahead and get the treatment that they need. Doctor, thank you so much for your time. We appreciate it.
Thank you.
To learn more about Austin Retina Associates or to schedule an appointment, go to austinretina.com or call the number on your screen.